Kevin Brown, DPM, Doctor of Pediatric Medicine. I work at Scott Orthopedics in Huntington, West Virginia, and the main hospital I work through is St. Mary's Medical Center in Huntington as well. It seemed very nice. The outer layer seemed very durable, seemed to have a little bit more cushioning as well. It seemed to me to be lighter and seemed to be a little bit more versatile as far as using it for wound care and also as post-operative immobilization, after bunionectomies, forefoot, midfoot procedures. It's been a very impressive shoe that I've used thus far. I've had great results with it. The biggest, I guess, perk of the DUOPro is the air core insole. It doesn't tend to bottom out. Other shoes would wear down a little bit faster. The materials would bottom out. The air core layer is very durable. As a result of that, I've had much quicker improvement in offloading wounds and getting wounds to close, neuropathic ulcers, things like that. And I've also started using it for 6 to 8 weeks after bunionectomies and offloading procedures for surgical patients as well. For example, I have a couple patients right now that I've had them using the DUOPros for almost 8 weeks. And these are fairly heavy individuals, 275, 300 pounds, and they're using the shoes daily. They obviously have some wear, but they haven't broken down. A lot of other post-op shoes and offloading shoes would have broken down a lot sooner. So I'm seeing a much more longevity with using these. They just don't break down as often, and it keeps the pressure off the wounds where it needs to be. Easier gait progression, heel to toe in the gait cycle using the DUOPro. And as I said before, it just seems to hold up a lot better. That air core has really been nice as far as rebound and limiting other areas from breaking down as well. I've noticed a big difference. I would say most folks, if they're compliant using the DUOPro shoe, I've seen 25 to 30% reduction in wound size within 2 to 3 weeks in some patients, which is pretty amazing. Without reservation, just so much more durable. I think they're going to have a lot more uses as far as post-surgical offloading for reconstructive things. I just think it's a very durable shoe, and it seems very light, and people tolerate it very well compared to other shoes that I've used in the past. I think it's because it's just more comfortable and it's lighter, and I'd recommend it without reservation.